Okay, so let's file this under more unintended consequences on this war on women. Or at least, probably most people didn't see this coming. I would think that, harming women was the goal of a lot of these abortion bans. But for those who thought that they were just, helping these poor, innocent, unborn children against these big meanies who want to abort them for, I don't know, being sluts. Anyway, medical residents are starting to avoid states with abortion bans, data shows. So, and this is residents of all specialties. We're not just talking people who are going into gynecology. We're talking across the board, which doesn't just harm women's health. This harms everybody's health because you're not getting the best care. You're not getting a new residents with new information, new ways of doing things. You're not getting that. Why? Because they don't want to come to your state, because your state hates women. So, let's just get right to the article. Isabella Rosario Bloom was wrapping up medical school and considering residency programs to become a family practice physician when she got some frank advice. If she wanted to be trained to provide abortions, she shouldn't stay in Arizona. Which, that's fair. Bloom turned to programs mostly in states where abortion access, and by extension abortion training, is likely to remain protected, like California, Colorado, and New Mexico. Arizona has enacted a law banning most abortions after 15 weeks. I would really like to have all the training possible, she said, so of course that would have still been a limitation. In June, she will start her residency at Swedish Cherry Hill Hospital in Seattle. According to new statistics from the Association of American Medical Colleges, or AAMC, for the second year in a row, students graduating from U.S. medical schools this year were less likely to apply for residency programs in states where abortion bans and other significant abortion restrictions. Since the Supreme Court in 2022 overturned the constitutional right to an abortion, state fights over abortion access have created plenty of uncertainty for pregnant patients and their doctors. But that uncertainty has also bled into the world of medical education, forcing some new doctors to factor state abortion laws into their decision about where to begin their careers. 14 states, primarily in the Midwest and South, have banned nearly all abortions. The new analysis by the AAMC, exclusively reviewed by KFF Health News before its public release, found that the number of applicants to residency programs in states with near total abortion bans declined by 4.2% between 2024 and 2023, compared with a 0.6% drop in states where abortion remains legal. Notably, the AAMC's findings illuminate the broader problems the abortion bans can create for a state's medical community, particularly in an era of provider shortages. The organization tracked a larger decrease in interest in residencies in states with abortion restrictions, not only among those in specialties most likely to treat pregnant patients, like OBGYNs and emergency room doctors, but also among aspiring doctors in other specialties. It should be concerning for states with severe restrictions on reproductive rights that so many new physicians across specialties are choosing to apply to other states for training instead, wrote Atul Grover, executive director of the AANC's Research and Action Institute. The AANC's analysis found that the number of applicants in OBGYN residency programs in abortion-banned states dropped by 6.7%, compared with a 0.4% increase in states where abortion remains legal. For internal medicine, the drop observed in abortion-banned states was over 5 times as much as in states where the abortion is legal. In its analysis, the AANC said that an ongoing decline in interest in abortion-banned states among new doctors ultimately may negatively affect access to care in those states. No shit. Dr. Jack Resnick, Jr., immediate past president of the American Medical Association, said the data demonstrates yet another consequence of the post-Roe v. Wade era. The AANC analysis notes that even in states with abortion bans, residency programs are filling their positions, mostly because there are more graduating medical students in the U.S. and abroad than there are residency slots. Still, Resnick said, we're extremely worried. For example, physicians without adequate abortion training may not be able to manage miscarriages, ectopic pregnancies, or potential complications, such as infection or hemorrhaging, that could stem from pregnancy loss. Which, of course, the people who enacted these bans didn't think of because, obviously just abortion banned. No thinking as to what it means. Those who work with students and residents say their observations support the AANC's findings. People don't want to go to a place where evidence-based practice and human rights in general are curtailed, said Beverly Gray, an associate professor of obstetrics and gynecology at Duke University School of Medicine, which makes perfect sense. Abortion in North Carolina is banned in nearly all cases after 12 weeks. Women who experience unexpected complications or discover their baby has potentially fatal birth anomalies later in pregnancy may not be able to receive care there. Gray said she worries that even though Duke is a highly sought training destination for medical residents, the abortion ban impacts whether we have the best and brightest coming to North Carolina. Rohini Kusala Siva will start her obstetrics and gynecology residency at MedStar Washington Hospital Center in Washington, D.C. this year. She said she did not consider programs in states that have banned or severely restricted abortion, applying instead to programs in Maryland, New Hampshire, New York, and Washington, D.C. We're physicians, said Kusula Silva, who attended medical school in Virginia and was previously president of the American Medical Student Association. We're supposed to be giving the best evidence-based care to our patients, and we can't do that if we haven't been given abortion training. Another consideration, most graduating medical students are in their 20s, the age where people are starting to think about putting down roots and starting families, said Gray, who added that she is noticing many more students asking about politics during their residency interviews. And because most young doctors make their careers in the state where they do their residencies, people don't feel safe potentially having their own pregnancies while living in those states, with severe restrictions, said Deborah Stuhlberg, chair of the Department of Family Medicine at the University of Chicago. Again, that makes perfect sense. People don't want to practice medicine in an area where everything that they do will be second guessed. And also, female doctors especially don't want to work in a state where they don't feel comfortable starting a family because they don't know when they're going to be in a need of medicine that the state has deemed unnecessary, because obviously the state has a medical degree. Now, I'm wishing that this article would also focus on the fact that this ultimately hurts men too. Because if these doctors are not coming to these states and they are in other specialties, that affects men too, because they're not going to ultimately get the care they need, because people are going to want to avoid the state for one reason or another. I'm sure there are a lot of male doctors who also avoid these states for that very reason. Would I want to have a family in a state where my spouse couldn't get the care that they need? My spouse, my significant other, whatever, won't get the care that they need because abortion. So, let's see. Stuhlberg and others worry that this self-selection away from states with abortion restrictions will exacerbate the shortages of physicians in rural and underserved areas, which it will. It will totally do that, because there's already an issue. I live in a rural area. There is an issue getting physicians, getting nurses. And again, who wants to work in a place where, number one, their medical expertise will be questioned because, obviously medicine and medical science is fine except for these areas we say it's not, or just being able to live their own lives. So yeah, this makes total sense to me. And it's going to hurt the areas that probably need people to come to them the most. The geographic misalignment between where the needs are and where people are choosing to go is really problematic, she said. We don't need people further concentrating in urban areas where there's already good access. Exactly. They should be able to go to other areas, but if you're afraid to, whether it be because of training or whether it be because of your personal life, because let's face it, these people know that you never know when you're going to need care and in what areas, which is why this should be legal, because you just never know. And the people who pass these bans either just hate women in general or can't be bothered to think of that, of the consequence of what type of people need abortions and why. They just, I don't know, think that they're all skanks. So, I mean, there was a legislator, and I believe it was Idaho, who, after the abortion ban was passed, and he heard all these stories about how this was affecting women, suddenly it's like, oh, oops, because he was unaware. I'm sure people mentioned it to him, and he probably was, being the tough guy, saying, "Oh yeah, they're just making shit up," until until he saw that it was happening, and suddenly he realized, oh yeah, maybe I shouldn't have voted for that. So a lot of people don't even think about it. And then we have idiots who I've mentioned many times before who think ectopic pregnancies can be implanted into the uterus. So these are not intelligent people. Definitely not when it comes to medicine. And I'm being generous because I wonder what else this idiot believes. But whatever. Let's continue. After attending medical school in Tennessee, which has adopted one of the most sweeping abortion bans in the U.S., Hannah Light Olson will start her OBGYN residency at the University of California, San Francisco this summer. It was not an easy decision, she said. I feel some guilt and sadness leaving a situation where I feel like I could be of some help, she said. I feel deeply indebted to the program that trained me and to the patients of Tennessee. Light Olson said some of her fellow students applied to programs in abortion ban states because they think we need pro-choice providers in restrictive states now more than ever. In fact, she said, she also applied to programs in abortion ban states where she was confident the program had a way to provide abortion training. I feel like there was no perfect 100% guarantee. We've seen how fast things can change, she said. I don't feel particularly confident that California and New York aren't going to be under threat too. Exactly. There are plenty of Republicans in the federal legislature who want to have a federal ban on abortion, which will end up affecting everybody, not just in the current total ban states. And yes, I'm sure, yes, a pro-choice perspective would be helpful in those states. But if they're afraid to go there because of what will happen to them if they provide that care, you also can't blame them for wanting to stay away, even though these are the states who need it more than others. As a condition of a scholarship she received for medical school, Bloom said, she will have to return to Arizona to practice, and it is unclear what abortion access will look like then, but she is worried about long-term impacts. Residents, if they can't get the training in the state, then they're probably less likely to settle down and work in the state as well. Because again, duh. Why would you want to live in a state where people treat you like a second-class citizen? That if you were to get pregnant and if something were to go wrong, that you would have to leave the state in order to get the care that you need, simply because a bunch of nimrods decided that they know better than people who have been trained to take care of pregnancies. They think they know better than them how to go about the care that a woman needs. Because again, for those who haven't figured it out yet, people who are pro-choice aren't like, abortions, yeah. No, that's not how this works. They do not like abortions. They would rather not need to provide them because nobody wants to be faced with that dilemma. But they also are aware that it needs to happen, that there are situations where this needs to be done. And it's not for some yahoo in the state's capital or just anyone who isn't part of this situation. It isn't for them to decide who gets medical care and who doesn't, simply based on your idea of who gets an abortion, or let's think of the fetus, which they proceed to give less than two shits about when the baby is born. Because if you care about women who are pregnant, you would make sure that they get proper care. You would make sure that there is care for them and the baby after the baby's born. But that is not what they want. They just want to have bodies. They do not care about the quality of those people's lives. They just want potential voters. They really do not give a shit about anything else. So yeah, as I said, I would have loved for this article to have also talked about the other physicians, the other specialties. Yeah, they mentioned the one woman, but they didn't mention, are there oncologists who aren't going to the States for that reason? Are, what other specialties which will affect men? Because unfortunately, we are living in a time where, and in a country apparently, where toxic men seem to think that unless it affects them, they really don't care about what happens to women. So, yeah, more of how it affects men would be, more direct. Because you can read between lines and see that it affects men, but these type of men need to be told up front. They need to be hit over the head with a mallet before they get it that this affects them too. But with that, I believe I've covered this article, and I will see you guys in the next video.